Hey, it's Booger. Christmas is just around the corner, and I have an excellent gift idea for your family and friends. It's called Advanced Cell Technology, and one share is only 10 cents. Yes, you heard that right, 10 cents. So why buy Advanced Cell Technology? Advanced Cell Technology has not one, but 4 potential home run programs. First, there's the Blastomere, a program to develop embryonic stem cell lines without destruction of embryo. ACTC is the only embryonic stem cell company that owns the patent to this technology. Second, there's the retinal pigment epithelium, RPE, a program to treat age-related macular degeneration, AMD, and retinal degenerative diseases. Third, there's Myoblast, a program to treat of heart disease, heart attack, and heart failure. And last, there's the Hemangioblast program, a treatment of diseases and disorders of the circulatory and vascular systems. ACTC owns or licenses over 250 patents and patent applications related to stem cell and regenerative therapies. Program, synthesizing stem cells without harm to the embryo. Company scientists successfully generate stem cell lines without destruction of embryo. Cell lines retain potential to form all cells in the human body. Potential to treat a range of human diseases. Technology has been reproduced and peer-reviewed on several occasions. First proven alternative HESC method enables the derivation of new HESC lines via pre-implantation genetic diagnosis, PGD, method, preserving development potential of the embryo. 10 HESC lines generated without embryo destruction. Biopsied embryos remain viable. Blastomere HESC lines should be eligible for federal funding. RPE program. Why RPE? Pigmented epithelium cells are easy to identify in a petri dish with the naked eye, assists in cell purity process. Small dosage versus other therapies, easy to track cells' whereabouts. No risk of rejection at the injection site. The eye is an immune-privileged site, and is not susceptible to the rejection and immune reactions familiar with transplantation in other parts of the human body. Ease of administration. Cells administered to the patient via a needle doesn't require a separate approval by the FDA, universal applicator. Procedure is already used by eye surgeons, no new skill set required for doctors. The disease indication itself, over 200 retinal diseases that the RPE cell therapy may positively impact, including several orphan indications. Large target market, over 12 million individuals in U.S. with AMD representing a multi-billion-dollar sign potential market. RPE program, current status second quarter, 2009. ACTC and collaborators at the KCI Institute present promising data supporting safety and efficacy of stem cell therapy to combat retinal disease. First quarter, 2009. ACTC completed the third-party tumorigenicity study for RPE. Second quarter, 2008. ACTC completes the RCS rate study. First quarter, 2008. ACTC completes pre-IND with FDA. 2009 year-to-date milestone achievements for RPE program pivotal studies. Full safety and tumorigenicity studies demonstrating safety and cell survival completed with positive results. Funding status. recently raised $15 million to complete preclinical and phase I clinical trials. Embryonic stem cell lines rescue visual function in a rat model for photoreceptor degeneration. Our results show that well-characterized GMP-compliant embryonic stem cell-derived RPE cells can survive after transplantation to the subretinal space of RCS rats, integrate into host RPE layer without migration into the retina, and continue to express at least some of the molecules characteristic of RPE. The cells are effective in rescuing photoreceptors from degeneration and result in significant rescue of visual function over sham-operated animals for the long term. GMP-compliant human RPE cells derived from Myoblast program highlights. Target market for Myoblast program sufferers of heart failure, chronic heart failure, and patients with scarred or ischemic dead heart tissue caused by or related to heart attack. FDA status: clearance from FDA to proceed with phase II clinical trials. Most experienced Myoblast team in the world, the development team has worked together for over 10 years. Strong intellectual property, mitogen licensed from Genvec, who acquired from Diacrin. Transaction closed in September 2008. ACTC acquired mitogen for common stock. Hemangioblast program, partnership. Joint venture with leading Korean stem cell developer Cha Biotech Co. Newly formed entity, Stem Cell and Regenerative Medicine International, is focused on the development of human blood cells and related products. ACTC provides an exclusive license for its technology to the joint venture. The ACTC therapeutic timeline. Timetable for therapeutic program milestones quarter. File IND for a specific degenerative retinal disease indication Q4 2009. Completion of 6-month tumorigenicity studies for RPE Q1 2010. Receive FDA clearance to commence with phase I clinical trials Q2 2010. Treat first patient in history with a HECS-based therapy Q3 2010. First quadrant safety data on treated patients Q4 2010. File second phase I IND for another retinal disease Q2 2010. Announce second cellular-based IND in area other than the eye Q2 2010. And the best part, you get all of these programs for 11 cents. So instead of buying your child or grandchild a new Xbox this Christmas, give them a future. God knows what the future will look like and whether there will still be college scholarships, so hurry. And by now, ACTC filed their first IND. So 11 cents is a limited time offer. You can find advanced cell technology under the symbol ACTC trading on the bulletin board. Good luck and God bless.